Welcome back to Chamber Exchange, the TV show. I want to thank our sponsors, Saint Vincent Hospital and Bank Hometown, for helping make the show happen. In our second segment, our conversation around healthcare continues. In the first segment, we had Joe Garcia and Liz Granada, who is a physician assistant and clinic director for Game Day Men's Health here in Worcester on Thomas Street. And Joe is the owner of that franchise. And now in our second segment, we've got Dr. Kevin DiSilvestro, who's the spine and orthopedic surgeon with Saint Vincent Hospital. Kevin, welcome.
Yeah, thanks for having me. It's great to be here.
Yeah, so, healthcare, last week we talked with a urologist from Saint Vincent Hospital. This week, spine and orthopedic surgery. So, maybe you could talk a little bit about your background, kind of what got you into that field, and then we can maybe talk about symptoms and treatments and things that are happening.
Yeah, absolutely. So my interest in medicine, and more specifically orthopedic surgery, started when I was in high school, and I had the opportunity to shadow the team doctor for the Phillies and got to be in the clubhouse with him, watch him taking care of the players, and saw a total knee replacement. And I kind of knew from that moment on that was going to be my career path.
Yeah, you had that aha moment.
Yeah.
How'd the Phillies do that year?
They actually did pretty well. I think it was the year after that was when we won the World Series, and they've broken my heart a couple times since then. But
yeah.
Well, looking forward to next year.
As Red Sox fans, we had that for many years. But so spine surgery, let's just maybe go back and do like medical 101. I think most people know how important the spine is in so many ways. But what does the spine do?
Yeah. So I mean, the spine has a couple functions in terms of just it's what all of your head and legs and arms are all attached to, and it kind of stabilizes everything. So it's kind of the bony structure around your spinal cord and the nerves that are coming out, and certainly serves an important function in everyday life.
Right. And in our first segment, we were talking about the aging process and certain conditions that can develop. And you mentioned you kind of got the healthcare doctor bug when you watched in sports. I mean, spinal cord injuries of various times happen. There's degenerative issues. So, what should people be on the lookout for if they're experiencing pain? And
sure. So some of the kind of the more common issues that I deal with. So one of the most important ones I would think is cervical myelopathy. So that's when you have pressure on the spinal cord itself, and that can happen usually in the neck or in the upper back. And that'll present with usually hand clumsiness. So if someone starts dropping things, if they have difficulty with buttons or difficulty putting jewelry on, it can impact their balance. And that's something that can progressively get worse over time.
Really?
Another thing that patients frequently present with is radiculopathy. So that's a pinched nerve. And that can present as pain or weakness or numbness, usually in one of the arms or one of the legs. And then another one of the third most common things that we see and treat is going to be neurogenic claudication. And that's when the lumbar spine or the lower back is too narrow for all of the nerves, and that'll usually present as kind of a achy, crampy pain in the back of your legs. Usually occurs after walking a short distance, and a lot of times will feel better if someone bends forward or pauses to take a rest. And so not everybody knows all of those things would be coming from the spine. So certainly if you have any of those symptoms, then I would definitely be considering that it could be coming from your spine.
Yeah, no, that first one, I had never heard that. So if someone is having some of those things, or they're becoming more frequent or persistent pain, obviously touch base with a doctor, and then kind of what's the process?
Yeah, so a lot depends on kind of which one of those you're presenting with. So certainly if somebody's, their main complaint is shooting pain down an arm or a leg, then we're going to start far more conservatively. So that's where, I work really closely with physical therapy and trying to just restore someone's function and their flexibility and core strength and mobility and all of those important things to kind of restore their quality of life. If someone's presenting with weakness or complete numbness in a distribution, then you know that nerve is getting pinched pretty badly, and then you might consider being a little bit more aggressive of trying to go in there and take that pressure off the nerve. And then finally, if someone's coming in with that first one that I spoke of, the cervical myelopathy, with that hand clumsiness and the balance issues, that's one that we know if you ignore the natural history, is that it will just progressively get worse over time to the point where it's very difficult to use your hands for normal activities or difficult to walk around. And so that's one of the conditions that we might be a little bit more aggressive surgically up front to try to, one, prevent the progression of those symptoms, and two, if we catch it early enough, hopefully restore some of that function.
Yeah, and surgery, sometimes that that is it's a serious, anytime you have surgery, it's a serious thing, but with technology and and especially Saint Vincent, I've been over the years for different things, and some of the technologies that they've utilized in the Institute. It's amazing what can happen. So maybe, what are the perceptions or misperceptions as it relates to surgery?
Yeah, so I mean, that's an excellent question. When you mention spine surgery, people usually are like, oh,
Right.
that's the last thing in the world I want. And I certainly understand that, and I certainly try to exhaust all of the other measures before we get to relying on surgery. But I think spine surgery has come a really long way. It used to be that there'd be this ginormous incision, and you'd be in the hospital for many days, and it'd be incredibly painful in the recovery. But I've been trained in some of the more minimally invasive techniques, so now we can use much smaller incisions, sometimes 2 centimeters or less. And instead of removing all of the muscle off of the bone to visualize everything, we just kind of push it out of the way with some dilators and hold it back with a tubular retractor. And then I use a microscope and specialized instruments so that I can do all of my surgery, but minimizing the damage to the soft tissues around the spine. And then at the end of the case, you simply remove the tube, all of that muscle kind of falls back into place, you close up the skin. And I've found that people do a lot better, at least in the short run, with that sort of procedure, because you're not damaging all of those muscles or doing a wide dissection. So there's a lot of procedures that patients are able to go home that same day or just spend one night in the hospital, and it can help a lot with decreasing all of the risks in the short run. Some of the other advances that we have and that I'm excited to bring to Worcester is motion sparing surgery. So a lot of the times if you had to do a procedure through the front of someone's neck, you then often have to go in and fuse those 2 levels. And in appropriately selected patients, we now have newer implants that we can offer that still allow for motion at the segment that I was operating on. And that has the theoretical benefits of protecting the levels above and below, reducing the amount of stress that is then now seen by the rest of the spine. So I think spine surgery's come a long way, and I'm really excited to kind of bring some of this new technology.
Yeah, when you mentioned the muscle
innovation.
thing, I'm just over the years listening to stories and people talk, when you have to cut into muscle, or that recuperation time, healing time, and pain, even it's that this new surgery that you've got, or you can utilize in certain situations, can avoid that.
Yeah, that's certainly the goal. I mean, my goal whenever I'm operating on someone is to restore them to function or help with their pain. And so any methods that I can use to achieve those goals faster is something I'm always going to try to incorporate in my practice.
Right, and then that last technology you talked about that can help avoid the fusion of
So it's usually going to be of 2 vertebrae, the bones
right,
in
yeah,
the spine. Yeah.
And that's sometimes what happens when people are experiencing pain, right? The vertebrae.
Yeah, so a lot of times what'll happen is you get the disc that's in between the 2 bones will wear out, and then sometimes in response to that, the disc might herniate and put pressure on the spine or the nerves. The bones will then overgrow to try to compensate. The ligament back there will also overgrow to try to compensate. So a lot of times you have to go in and remove that overgrown bone and ligament or that disc, and then depending on how you're approaching the spine and what the indications were for why you're doing that surgery, certainly if we can retain motion in someone, then I think that's a great option to be able to offer. Sometimes you still have to fuse to stabilize things, or if their spine is not one that would do well with motion sparing surgery. But it's just nice to have different things to offer patients.
Right, right. And in this department at St. V's, want to talk a little about that in a minute or 2 we got left?
Sure. So I share an office with Dr. Steve Desio, who's been a phenomenal mentor. He's a sports medicine surgeon, and it's just been great to jump right in with him, and he sends me lots of patients. And a lot of times people have issues in their knees and their hips and their shoulders and their spine, and so we work really closely together to figure out exactly which part of their body is bothering them the most, and who's going to be.
What if it's all of them?
Yeah, sometimes that happens, but that's why we work closely together and able to help people get back to doing the things they want to do.
Yeah, and there's one question on here, we've kind of ad-libbed it here a little bit, but one of the questions is lifestyle changes to help patient manage his or her pain. Is there anything particularly that people can do to kind of avoid
so certainly
spinal stresses?
Absolutely. Certainly the healthiest lifestyle that you can live. So the less weight that you have on your body, then the less force that your spine sees is always going to be helpful. The more you can exercise and strengthen your core, again, is going to help protect the forces that your spine sees. Certainly bad habits.
Strengthening a core, stretching, yoga.
Right. All of those things.
Sit-ups.
Not smoking is
Right,
another big one, especially if you do need spine surgery, then it increases all of your risk factors, reduces bone healing. So all of those things kind of come together and can help protect your spine.
Got it. Well, Well, we got a minute left. It's the holiday season. Maybe you want to give a shout out to a couple little ones that might
Yeah,
be
sure.
watching.
So I definitely wanted to thank
and
my
your
wife,
wife?
Jessica, who's also, she's a surgeon. She's a gynonc, women's cancer surgeon. So always super impressed by everything she does. And then I want to wish a Merry Christmas to my daughter, Madison. And then we have another one on the way due in January. So looking to expand our family.
Good stuff. Well, thank you for being with us here on the show and Saint Vincent Hospital, one of our largest employers and biggest taxpayers in the city and region. So Dr. Kevin DiSilvestro, who's the spine and orthopedic surgery point person at Saint Vincent Hospital. Kevin, welcome.
Perfect. Thank you so much.
Thanks for being with us.
Yeah.
We'll be right back for our final segment.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.